How does primary gout develop? Imagine your joints feeling suddenly painful, swollen, and red, often in the big toe or other joints. That's what happens during a gout attack, but how does it all start? Primary gout begins with a buildup of uric acid in the blood, a condition called hyperuricemia. Uric acid is a waste product created when your body breaks down purines, which are found in many foods and in your body's cells. Normally, your kidneys help remove uric acid through urine, keeping its levels balanced. But sometimes, uric acid levels become too high. This excess uric acid can happen in two main ways. The first is overproduction, which is less common and can be caused by genetic factors that affect how your body processes purines. For example, some people have enzyme defects that lead to increased uric acid production. Conditions like certain cancers or treatments that cause rapid cell turnover can also raise uric acid levels. The second and more common way is underexcretion, where your kidneys don't remove enough uric acid. This can be influenced by genetic factors affecting kidney function, kidney disease, or medications like diuretics that reduce uric acid clearance. When uric acid levels in the blood become too high, uric acid begins to crystallize into tiny needle-like structures called monosodium urate crystals. These crystals tend to deposit in joints and surrounding tissues. Once they form, the immune system recognizes these crystals as foreign invaders. Immune cells called macrophages try to engulf the crystals through a process called phagocytosis. This triggers a series of reactions inside the immune cells, activating a complex called the NLRP3 inflammasome. This activation leads to the releases of inflammatory substances like interleukin-1 beta, a cytokine that promotes inflammation. The releases of these inflammatory signals causes the classic symptoms of gout: swelling, redness, warmth, and intense pain in the affected joint. The immune response attracts more immune cells, amplifying the inflammation and making the attack worse. This process explains why gout attacks can be sudden and severe, often waking people up at night. Several factors can increase the risk of developing primary gout. Genetics play a big role, with family history increasing susceptibility. Diet is also important. Foods high in purines like red meat, shellfish, and foods rich in fructose can raise uric acid levels. Obesity and metabolic conditions such as diabetes or high blood pressure further contribute to the risk. Certain medications, especially diuretics and low-dose aspirin, can interfere with uric acid excretion. Understanding how primary gout develops helps in managing and preventing attacks. It's essential to recognize that individual factors vary, and proper diagnosis and treatment should always involve healthcare professionals. Maintaining a balanced diet, managing weight, and following medical advice can help keep uric acid levels in check and reduce the chances of future gout episodes.